In this video, we show a patient who underwent vitrectomy due to intraocular hemorrhage secondary to Terson syndrome. In this case shared by Dr. Lucas Valadão from São Luís, Brazil, a young patient underwent vitrectomy in the right eye due to vitreous hemorrhage and macular hemorrhage following Terson syndrome. Terson syndrome is characterized by intraocular hemorrhage associated with subarachnoid hemorrhage, intracerebral hemorrhage, or traumatic brain injury. Intraocular hemorrhage may be present in the vitreous, retina, subretinal space, subhyaloid space, or beneath the internal limiting membrane. In this case, the surgeon performs a core vitrectomy, removing the vitreous hemorrhage to improve visualization of the posterior pole. Next, triamcinolone is used to facilitate posterior hyaloid removal, followed by vitreous base shaving. Brilliant blue is then applied, and using retinal forceps, the surgeon creates an opening in the internal limiting membrane. The hemorrhage beneath the ILM helps initiate the peel, as the blood creates a plane between the internal limiting membrane and the other retinal layers. The blood located beneath the ILM is then washed out from the macular region. Vitreous base inspection is performed under scleral indentation, and at the end of surgery, a fluid-air exchange is carried out.